Assalamu alaikum everyone. Hope so you all are doing well. Anyways, my name is Maham Jameel and I'm from the department BS Biotechnology. Today I'm here to represent a presentation topic of chemistry with you. My presentation topic is Propofol. First of all, I'm telling you about the contents of this topic. Introduction of Propofol, chemical structure and properties of Propofol, pharmacokinetics, clinical use, adverse effect of Propofol, number 6 latest research, and number 7 last one future directions of Propofol. First of all, we are going to discuss what is Propofol. Basically, Propofol is a sedative hypotonic medication that is commonly used for the induction and maintenance of anesthesia. Propofol is also known as 2,6-diisopropylphenol or dipravin. Sedative hypotonic medication means class of drug used to induce or maintain sleep, and anesthesia means insensitivity to pain. Now, some studies suggest that it may be suitable agent to replicate normal sleep. Propofol. How it works? By enhancing the activity of neurotransmitter gamma aminobutyric acid GABA in brain, which produce a calming effect and decrease patient awareness and ability to feel pain. Short acting medication result in decreased level of consciousness and lack of memory. Now, the chemical structure and properties of propofol. As you can see, it is a benzene-like ring and methyl group and hydroxide attached to this ring. Formula C12H18 and O. Molar mass of propofol is 178.275 gram per mole. Diisopropylphenol, also known as propofol, is a short-acting medication that results in decreased level of consciousness and lack of memory events. Then physical state of propofol. Physical state, propofol is basically it is a clear colorless liquid at room temperature. Although it has a distinct medicinal odor, solubility of propofol highly lipophilic, soluble in fats and oils. Lipophilic mean sparingly soluble in water but formulated as an emulsion for intravenous administration. Intravenous mean within the vein. Sorry. Boiling point of propofol is 155 to 157 degrees Celsius. Density it's about 0.97 gram per cube centimeter cube. Melting point is 18 to 20 degrees Celsius. Now we are going to discuss in detail what is GABA. GABA stands for gamma aminobutyric acid. It is a neurotransmitter in the central nervous system that plays a crucial role in regulation of brain activity. It is primarily inhibitory in neurotransmitter, meaning it reduces the activity of neurons and help maintain balance between excitation state and inhibition in brain. Some key detail about GABA structure. What is the structure of GABA? GABA is an amino acid, although it is not used as building block for protein like other amino acids. It is synthesized from the amino acid glutamate through a process called decarboxylation, which removes carboxyl group from glutamate. This is the structure of GABA. And function, what is the function of GABA? GABA acts as binding to specific receptor on the surface of neuron known as GABA receptor. When GABA binds to these receptor, it triggers inhibitory effects leading to the suppression of neuron activity. This inhibition help regulate various brain functions including anxiety, sleep, muscle tone, and seizure control. These are the function of GABA. Neurotransmission. Now we discuss what is neurotransmission. GABA is released by presynaptic neurons into a synaptic cleft, the small gap between neurons. It then bind to GABA receptor on postsynaptic neuron, which trigger a series of chemical reaction that decrease the excitability of postsynaptic neuron. This inhibitory effect prevent the excessive firing of neuron and help maintain balanced level of neural activity. GABA receptor. There are two main type of GABA receptor: GABA A and GABA B receptor. GABA A receptor are ion channel that allows aqua of chloride into ions into the neuron, leading to hyperpolarization and reduced neural excitability. GABA B receptors are metatropic receptors that modulate neuron activity through a complex signaling cascade involving intracellular messenger modulation. GABAergic signaling is modulated by various factors, including direct drugs and substances. For example, benzodiazepines such as Valium and Xanax enhance the effect of GABA and GABA A receptor, leading to increased inhibitory and sedative effects. Alcohol also enhance GABAergic signaling, contributing to its sedative and anxiolytic properties. GABA imbalance. An imbalance in GABA level or function has been implicated in various neurological and psychiatric disorders. Reduced GABAergic function is associated with conditions like anxiety disorder, epilepsy, and insomnia. Conversely, excessive GABAergic activity may contribute to conditions such as sedation, impaired cognition, and certain forms of epilepsy. Point to be noted: understanding the role of GABA in brain has significant implication for the development of therapeutic intervention targeting the GABAergical system. Drugs that enhance GABA activity and used to treat conditions like anxiety, insomnia, and seizures, while drugs that inhibit GABA activity may have a stimulant or antiepileptic effect. What is neurotransmitter and how it enhances the activity of GABA? Now we discuss this. A neurotransmitter is a chemical messenger that transmits signal across the synapse junctions between neurons. It is released from the presynaptic neuron and bind to receptor on the postsynaptic neuron, thereby transmitting the signal from one neuron to another neuron. To enhance the GABA activity of GABA, there are several steps. GABAergical agonists. These are the substances that directly bind to GABA receptor and mimic the effect of GABA. They enhance GABAergical activity by increasing the activation of GABA receptor. Examples of GABAergical agonists include benzodiazepines such as diazepam and alprazolam, and barbiturates such phenobarbital. These drugs are commonly used for anxiolytics, sedatives, and anticonvulsants. GABA reuptake inhibitors. These substances block the reuptake of GABA by inhibiting the transporters responsible for removing GABA from the synaptic left back into presynaptic neuron. By preventing GABA reuptake, more GABA remain in synapse, increasing its availability for binding to receptor and enhancing its activity. Example of GABA reuptake include tiagabine and nicotic acid. Transminase inhibitors. GABA transminase is an enzyme responsible for breaking down GABA in synaptic cleft. Inhibitory of GABA transminase prevent the degradation of GABA, leading to increased level of GABA and enhanced GABAergical activity. Vigabatrin is an example of GABA transminase inhibitor and is used to treat epilepsy. Positive allostatic modulator. These substances do not directly activate GABA receptor but bind to specific site on receptor complex known as allostatic site. By binding to these sites, positive allostatic modulator enhance the effect of GABA when it binds to the receptor, increasing the inhibitory response. Benzodiazepines, mentioned earlier as GABAergical agonist, also act as positive allostatic modulator, enhancing the activity of GABA A receptor. Point to be noted about how it enhance the activity of GABA. It is important to note that while enhancing the activity of GABA can be beneficial for certain conditions, specific for these certain conditions such as anxiety disorder and epilepsy, it is crucial to use these interventions under medical supervision as they can have high significant effect on central nervous system and may have potential side effects or interaction with other medication. Hope so you can understand. Propofol mechanism of action. Propofol is a short intravenous anesthetic agent widely used for the induction and maintenance of general anesthesia. As I mentioned earlier, anesthesia is the type of insensitivity to pain. Its exact mechanism action is not fully understood, but it primarily acts on gamma aminobutyric acid, which is stand for GABA system, and modulates several other neurotransmitter system in the central nervous system. Detailed explanation of mechanism of action of propofol. Basically, propofol exert as the antiemetic action on brain, which help reduce post-operative nausea and vomiting. This can be mentioned, but GABAergical modulation. Propofol enhance the activity of GABA, the major inhibitory neurotransmitter in the central nervous system. GABA act by binding the GABA A receptor, as I mentioned and explained earlier. What is GABA A? Which are ion channel that allow the influx of chloride ion, leading to neuronal hyperpolarization and decreased excitability. Propofol potentiates the inhibitory effect of GABA by binding to specific site known as elastic site on GABA A receptor complex. This binding increases the frequency and duration of the opening of chloride ion channel, resulting in enhanced GABAergical inhibition and overall inhibitory effect on the central nervous system. Modulation on other neurotransmitter system. um, Propofol also interacts with other neurotransmitter system in the central nervous system, contribute to its sedative and anesthetic effect. It has been found to inhibit the excitatory effect of glutamate, the major excitatory neurotransmitter, by interacting with N-methyl-D aspartate receptor and AMPA receptor. By inhibiting glutamate receptor. Propofol reduce excitatory transmission and enhance overall central nervous system inhibition. Potassium channel modulation. Propofol has been shown to enhance the activity of central potassium channel known as G protein gated inwardly recifying potassium channel are Gerk channels in the brain. Activation of these channels lead to hyperpolarization of neurons, further contributing to inhibitory effect of propofol. These are the effects, um, mechanism action which are going through in brain. Inhibition of calcium channels. Propofol inhibit voltage gated calcium channel, reducing calcium influx into neurons. This inhibition of calcium channel may contribute to propofol overall suppressive effect on neuronal activity. Point to be noted. It is important to note that precise interaction and mechanism by which propofol exerts its effect and still being studied are not only fully elucidated. Furthermore, propofol action can vary depending on specific brain region of neuronal circuit involved. While propofol is generally safe and effective when administered by trained medical professions, it is the potent anesthetic agent and should be used under appropriate medical supervision due to its potential risk and side effects. Now, what is science logic reaction? In the context of propofol, it is more appropriate to discuss the scientific and logical aspects of its mechanism of action and effect rather than referring to its science logic reaction. As mentioned earlier, propofol mechanism of action involve enhancing GABAergical inhibition, modulating other neurotransmitter system, and interacting with the specific receptor and ion channel in central nervous system. From scientific perspective, researchers have extensively studied propofol to understand its pharmacological properties, interaction with neurotransmitter system, and its impact on neuronal activity. These studies involve preclinical research using animal models, in vitro experiment, and clinical trial in human investigate propofol effect on central nervous system. Basically, logically, the understanding of propofol mechanism of action and its effect on body and brain is based on scientific evidence and logic reasoning. Obviously, we all know scientific scientists and researchers have conducted experiment, analyzed data, and formulated hypotheses to explain how propofol interact with GABA receptor, modulate neurotransmitter system, and ultimately produces its sedative and anesthetic effect. The logical deduction and conclusion about propofol are drawn based on scientific evidence, observations and principle of pharmacology, neurobiology, and anesthesia. This allows for better understanding of propofol effect on central nervous system and guides medical professions to its appropriate safe and during anesthesia. In summary, this scientific and logical understanding of propofol involves studying its mechanism of action, investigation its effect on neurotransmitter, and drawing conclusion based on experimental evidence and logic reasoning. Now, what is central nervous system? Mm, As central nervous system, we all something know about central nervous system. It is a vital part of human body, overall nervous system, and it is composed of brain and spinal cord. The central nervous system is responsible for receiving, processing, and coordinating information from body to external environment, as well as regulating numerous bodily function. Some key points and functions of central nervous system: brain. The brain is the central control of the body. It is responsible for wide range of functions including cognition, sensory perception, motor control, emotions, memory, and coordinate of bodily activities. The brain consists of several regions, each specialized for different function. Obviously, we all know that brain consists of different parts and every part have different function. Spinal cord. The spinal cord is a long cylindrical bundle of nerve tissue that extends from the base of brain down to vertebral column. Extend from brain to vertebral column. It serves as communication pathway between the brain and the rest of the body. The spinal cord relay sensory information from peripheral nervous system brain and transmit motor signals from brain to muscle and organs, different organs of body. Information processing. The central nervous system involved in complex information processing. It receives sensory input from body and external environment, processes and neuron, uh, integrates this information and generate appropriate response. This processing occurs through the interaction of neuron on the basis of building block of nervous system. Reflex. The central nervous system is responsible for generating reflex, are involuntary rapid responses to specific stimuli. Reflexes help protect the body and maintain homeostasis. For example, withdrawal reflex, where you automatically pull your hand away from the hot surface. Spinal cord, like reflexes, may basically when we touch, as we study, okay, when we touch something hot, our brain sends signals to our body and we immediately put our hand back. Higher cognitive function. The central nervous system play a crucial role in higher cognitive functions such as perception, attention, learning, memory, language, and decision making. These complex processes involve interaction between different regions of brain and integration of sensory, motor, and cognitive information. Control of bodily function. The central nervous system regulates various bodily functions, including heart rate, blood pressure, respiration, digestion, and hormone secretion. It coordinates the activities of different organ systems to maintain internal balance and respond to change in external environment. Understanding the structure and function of central is essential for studying and treating neurological disorders as well as advancing our knowledge of brain function and cognition. Now going, which is pharmacokinetics. About this is about propofol. It refers to its absorption, distribution, metabolism, and elimination. First of all, we discuss absorption. Propofol is administered intravenously due to its poor oral bioactivity. When given intravenously, it rapidly enters the bloodstream and exhibits a rapid onset of action. Distribution of pharmacokinetics. It has high distribution volume, indicating extensive issue distribution, rapidly crosses blood barrier, which its rapidly onset and short duration of action. Metabolism. It undergoes hepatic metabolism primarily by conjugation with glucuronic acid and the laser extent by hydroxylation. Major metabolites are propofol, gluconic acid, and propofol sulfate. Elimination. Half-life of propofol is relatively short, typically ranging from 2 to 24 hours. The exact duration is vary among the individual due to factors such as age, health, status, and dosage of propofol which we take. Most of it are excreted in urine with a small portion in feces. Clinical use of uh, propofol. Basically, clinical use. Propofol injection is used to help to relax or sleep before or during surgery or other medical process. This medicine is an anesthetic and sedative. Anesthesia and induction propofol is commonly used to induce anesthesia before surgical procedure, as I discussed earlier. It provides a rapid onset and short duration of anesthesia, allowing for smooth and controlled transition between the consciousness and unconsciousness. Propofol is also used for the maintenance of anesthesia during longer surgical procedures. Sedation in intensive care unit ICU, which stand for propofol, is frequently used for the sedation of mechanically ventilated patient. In ICUs, it provides effective sedation, rapid onset, and ease titration to achieve the desired level of sedation. Propofol is preferred for its short duration of action, which allows for rapid awakening and ascertainment of neurological status when needed. Procedural sedation. Propofol is employed for during diagnostic and therapeutic procedures such as endoscopy, cardiac catheterization, and imaging studies. Its rapid onset, predicate, duration of action, and minimal residue effect make it suitable choice for these procedures. Control of status of epipeuticus. It in the center cause of status epipeuticus prolonged seizure and repeat seizures without regaining consciousness. Propofol may be used for deep sedation or anesthesia to terminate seizure activity and produce seizure control. It can be administered as continuous infusion in ICU setting. Sedation in MRI scan. Propofol is often utilized for sedation during magnetic resonance imaging MRI and other radiological procedures, particularly claustrophobic or anxious patients who have difficulty tolerating the procedure without sedation. Propofol provides the necessary sedation while allowing the patient to remain still during the imaging process. Sedation for pediatric patient. Propofol is used for the sedation of pediatric undergoing diagnostic procedure or minor surgical interventions. Its short duration of action and favorable recovery profile make it suitable option for children. Propofol may be sedate coronavirus COVID-19 patient who need mechanical ventilation in intensive care unit ICU. Adverse effect. Basically, there are a lot of adverse effects of propofol. First of all, we discuss in detail, and then I'm telling about the common effects of propofol. Propofol is generally considered safe and well tolerated when administered by trained professionals. It is not without potential adverse effect. Here are some possible adverse effects. Respiratory depression. Propofol, like other sedatives and anesthetics, can suppress the respiratory drive, leading to respiratory depression. It is crucial to monitor the patient ventilation and oxygenation closely during propofol administration to prevent any complication related to inadequate breathing. Hypotension. Propofol can cause a drop in blood pressure due to its vasodilatory effect. The mechanism behind this is direct relaxation of arterial smooth muscle. Hypotension can be managed by adjusting the dosage and administration intravenous fluid of vasopressors or as needed. Allergical reaction. While rare, propofol can cause allergic reaction. Some patient symptoms may include itching, hives, or difficulty in breathing. Patient with history of allergical or allergic reactions should be closely monitored for sign of an allergic reaction during propofol administration. Pain on injection. Propofol is administered via injection, and some patients may experience pain and discomfort at injection site. To minimize this risk, propofol may be administered slowly or with local anesthetics. Propofol infusion syndrome. Propofol infusion syndrome is a rare but potentially life threatening condition that has been associated with the use of high doses of propofol over an extended period. The condition is characterized by metabolic acidosis, rhabdomyolysis, the breakdown of muscle tissue, and cardiac failure. To minimize the risk of propofol infusion syndrome, propofol is typically administered at the lowest effective dose for the short duration necessary upon post-operative nausea and vomiting. Propofol can cause nausea and vomiting in some patients during the post-operative period. This effect is typically mild and short-lived. Transient amnesia and disorientation. Propofol can cause temporary memory loss or confusion in some patients. This effect is typically short-lived and resolve once medication has been discontinued. Anesthesia agent can affect the chemio receptor trigger zone, CTZ, which stand for and vomiting center in brain, leading to the nausea and vomiting. Different anesthetic may have varying degree of emetological vomiting, including portion. This is how as I discussed, this effect is cause nausea. This is how it's called vomiting and nausea. Surgical trauma, the psychological stress and surgery and manipulation of organ during the procedure can stimulate the release of substances that trigger nausea and vomiting. Additionally, certain surgeries such as abdominal or eat surgeries are known to have highest risk of PON due to involvement of specific anatomical structures. Some other effects of propofol: development of cancer, low blood pressure, pauses in breathing lasting 30 to 60 seconds, pause in breathing lasting more, movement, injection site burning, sticking pain, respiratory cognosis during weaning, hypertriglyceridemia, high blood pressure. Respiratory ectosis means failure of ventilation and accumulation of CO2, and weaning mean when baby move from breath breastfeeding to other source of nourishment. Hypotension is a condition, hypertriglyceridemia, too many fats in body. These are the now latest research about propofol. Effects of propofol on the development of cancer in human. Acceptability of intravenous propofol sedation and adolescent dental care. Future of propofol. Here are some potential future propofol directions. Drug delivery system. Researchers may explore innovative drug delivery system to enhance the administration of propofol. This could involve developing novel formulation or delivery methods such as transdermal patches, nasal sprays, or inhalation system as we use inhaler. These approaches aim to improve patient comfort, optimize drug absorption, and provide more precise dosing control. Pharmacokinetics, as explained earlier in detail, pharmacokinetics enhance safety measures. Safety is crucial except of anesthesia, and efforts may focus on developing strategies to further enhance the safety propofol property of propofol. This could involve rehyming monitoring technique, implementing automated system for dose adjustment, or integrating advanced technologies to improve patient safety during propofol administration. Formulation involvement: propofol formulation may be improved to enhance stability, reduce pain on injection, and extend the shelf life of drug. Research may explore ensuring better patient experience and more efficient drug utilization. Neuroprotective properties. Propofol has shown potential protective effects in certain content such as in brain injury or stroke. Future research may develop deeper into understanding these neuroprotective properties and explore potential therapeutic applications of propofol in neurological condition. Thank you so much for listening. Hope so you understand it. Thank you so much for your precious time. Allah Hafiz.